Okay, everybody, thank you very much for joining us this morning. I'm Brooks Vostel. I'm going to be moderating this session, which primarily means I'm going to be watching the chat. So if you have questions for our presenters during their presentation, you can go ahead and type them into the chat, and I will interrupt them at an opportune time to make sure I ask. If you need anything specifically from me, you can use the direct chat function to contact with me. But otherwise, just add questions into the everyone chat. Um, our speakers for this session, seeking help from the school mental health providers for both students and educators, are Robin Dufresne and JP Ortman, colleagues of mine here in the School of Counseling and Special Education. As we get to the end of their presentation, I'll be watching time. We are going to ask that you go back to the main room at the end for some final closing discussion. But with that, I want to turn it over to Robin and JP. They can introduce themselves a little bit more. And thank you all for joining us.
Sure. Thanks, Brooks. Okay, so as Dr. Vostel said, I am JP Ortman. I am assistant professor here at BGSU in counselor education in the School of Counseling and Special Education. I am a licensed school counselor, and I've been in K-12 education for 20 years before I decided to come up to higher ed and go from there. So, and I'll let my colleague Robin introduce herself.
And I am Robin Dufresne, and I am an assistant teaching professor in the School of Counseling and Special Ed. And I have been at BGSU for 4 years. I'm a licensed professional clinical counselor with supervisory endorsement. And previous to that, I have about 14 years working with individuals with developmental disabilities. So that's my connection to like the school, as I spent a lot of time with IEPs and behavior plans and things like that for those friends of mine. So we're really excited to have you here today on a Saturday. I put in the chat the note slides deck and all of the links to any of the videos that are in our presentation today, so that if you wanted to, well, actually, we're not going to show them. You can watch them at a later time. And the self-care handout that we are going to go over on how to develop a self-care plan. So all of that is in the handout. And I think we're ready to go.
I think so.
Good deal.
So, yeah, so use the handout as we go through stuff. But we're going to talk about seeking help from school mental health providers for both students and educators. So one of the things that we'll talk about first is going through the who are the mental health providers in schools, because a lot of times it can get sticky, it can get confused. There are quite a few of them, and a lot of them have overlapping roles in a way. They can all do a number of different things, but some of them, they each have their own specialty as well, which I think is important. One thing that I always did as a school counselor is we had both school counselors and school social workers and school psychologists. In fact, we had pretty much all of these 5 at the school I worked at were there. The school-based therapist, the speech and language pathologist. And one thing we always said, I mean, we all had, sometimes there can be competing roles, but we always felt like there were enough needs among our students that no one was without work to do. There was always a student in need, and there was always somebody there that was able to help him, because we had all of these professionals there. So we'll go through the different types of professionals. What are some of their similarities? What are some of their differences? And we will go from there. But we'll start with the one that's near and dear to my heart, because this is what I was, is a school counselor. And notice on the side there, we do not call ourselves guidance counselors. So if you use the phrase guidance counselor, I ask you to try to work that out of your language and refer to them as school counselors. A guidance counselor is an outdated term, similar to in schools, we don't call them school librarians anymore. We call them the technological professionals. So the language matters there, because a school counselor does so much more than just guidance. They have a huge role in what they do. They help create comprehensive school counseling programs, and the comprehensive school counseling program is essentially there for all students. It's tiered very similar to your MTSS in terms of your tier 1, your tier 2, and your tier 3, where we have interventions set up for all students. We have interventions for the tier 2 students, and we have interventions that we do for tier 3 students in a number of different ways. We do individual counseling. School counselors will do where they meet with students one-on-one. And then the school counselors can do group counseling. Hopefully they come in and do classroom lessons on a number of different things. And then whole school initiatives are something else that they can help run and monitor and make sure that everybody in the school is getting some sort of needs met. To become a school counselor, you have to have a master's degree in school counseling. So it is a master's degree program. And the one thing that they look at is they address the academic needs of all students, the career development of all students, and then the social emotional needs of all students. They focus on all three domains, and a school counselor is trained to really kind of set up interventions for each one of those domains. So they're meeting the needs of students in all those domains. And like I said, we call, when I teach our learning school counselors at BGSU, we talk about the multi-tiered, multi-domain systems of support, where we have our 3 tiers, our tier 1, our tier 2, our tier 3, but we also have that for each of these 3 domains. So focus on the needs of all students in the academic, the college career, and the social emotional, making sure that every student is getting their needs, they're getting some sort of instruction or some sort of learning in those 3 areas. One thing I want to point out, which is something I always like to do when I talk about school counselors, is what's not listed here. School counselors are not trained in 504s or IEPs. They often are given some of those duties, but they're not trained in those duties. They're not trained to be test coordinators. They are trained to read assessments. They're trained to understand assessments and explain assessments, but they're not trained to set up the schedule for test coordination. They're not trained to build a master schedule. A lot of times school counselors are given some scheduling duties. When I was a school counselor, I would use the scheduling duties as an opportunity to address that college career domain. Like, what is somebody interested in? How do they want to go forward with their life? And then what are some good classes they may take that address them in that way? But as far as building the master schedule, that's a huge time suck that is not needed when there's students that are out there that need help. They're not trained to substitute teach. They may, sometimes they're asked to fill in quickly, as all school faculty are sometimes when there's a glaring need, but that's not something they should be doing. And the one thing I want to point out is school counselors are not trained to diagnose. They should have an understanding of basic mental health disorders, but they aren't trained to diagnose them. Now, if they are duly licensed, meaning they have both their school counseling license and their clinical license, they may be able to, but that's not part of their role, is to diagnose. So I always like to point out the differences there. I know I talked about a huge time suck. I always use this example of test coordinating. When I was a school counselor, test coordination was one of the duties that was assigned to me. And I was always good at tracking my hours and how my time was spent. And I spent essentially 90 plus hours on test coordination. And what I wanted to point out to my administration at the time is that was essentially 2 weeks that I was not working with kids. And I felt like that was just a failure on that part, because, I'm trained to work with kids. As school counselors, we're trained to work with kids. We're trained to spend time with kids in these areas. And if I'm spending 90 hours, 2 weeks of time on test coordination, that's 2 weeks I'm not working with kids. So I always like to point that out, because I think that was a valid point. I don't know if my administrators were too happy when I pointed that out, but it's because it's a hard argument to have. But I was always one who liked to push a little bit on that aspect. And so, sorry, I'll get off my soapbox now and turn it over to Robin to talk about school social workers.
Well, first we have to do a shameless plug. If you would like to be a school counselor, contact either JP or I to ask about our program here at BGSU. So,
Please.
if you are interested in that. All right, so school social workers are the next category of individuals who might be employed in a school. So basically a lot of what they do is a lot of crisis intervention. Sometimes they'll develop some academic interventions and address social behaviors, but the main job of a social worker, just in general of a social worker, is to connect and coordinate with community resources. So this is going to be one of the persons that is able to go out to the students' homes when they are missing school and they are struggling with making sure that they show up, or their family is struggling getting food from the food banks and things like that. And they can provide some of that community outreach that maybe a school counselor, a school-based therapist, a school psychologist isn't able to do. So they can go out and reach and do some outreach to bring people back in and make sure that they're getting into the schools. It's unfortunate that many of our schools are supporting students' nutritional needs, and so they end up having to eat many of their meals at school. So what the school social worker can do is reach out to those kids that aren't getting to school for whatever reason, and make sure that they also have a connection in the community to continue to provide that kind of a stuff. So becoming a school social worker requires a master's degree. There is one program in the Cleveland area that does do a school social worker master's degree, if this is something that you might be interested in your future. And it teaches you specifically the things that you need to be a social worker in a school versus a social worker in a community. And then you obtain licensure and work towards your independent licensure. So initially school social workers are LSWs, or licensed social workers, and then they move to licensed independent social workers. The thing about a social worker is that they are able to do diagnosis that is within their scope of practice. And so they can help on some of those 504s and things in order to provide that diagnosis for meeting criteria. So each of our slides has a video attached to it that is a link to someone that actually does this job that more eloquently explains what they do every day. But because we're limited to an hour, we don't have quite the amount of time to show you each video. So, all right, school psychologist.
I'd like to say about that school social worker video that we have here, just to highlight how these roles can be confused sometimes, is the school social worker in the video actually gives the wrong definition of what a school counselor does.
Yes.
So I find that funny. I mean, she does a great job of describing what she does as a school social worker, but then I believe she says school counselors would do scheduling, and we're like, oh no, that's not quite right. But
so the school social worker is an employee of the school district. So they may work at one school, or they may move to multiple schools within the district. Thanks for the question, Jessica. So each of these categories that we're going over of jobs are part of the 508 rule that is in licensure, not licensure, in state legislature. So these are jobs that 5 of the 8 of them have to be employed by schools, is my understanding. I think that's still the ratio, 5 of the 8 categories. I think nurse, PT, OT, and I don't remember what rounds out the 8, but that's my understanding of it. So that's why some schools only have school counselors and school psychs, because they might prioritize a different category. And the school social worker position is a relatively new position that we're seeing as our interns go out into the field. So sorry, JP, I didn't mean to cut you off.
No, you're fine. Absolutely. I'm glad that we clarify that, because that is a necessary distinction.
Yeah.
And we had school social workers at our site when I was a school counselor, and we would work with them on a number of different things. We would actually kind of collaborate on different students, and we would say, okay, maybe this student you guys should take, and we'll take this one, just because they fit better in different scopes of practice. Same thing with our school psychologists. School psychologists, they provide academic, behavioral, and mental health support as well. One thing that sets them apart is they're able to administer and evaluate their cognitive and behavioral assessments. A lot of times the school psychs at different school systems will be the ones that give the WISC, or the what is it, the Woodcock Johnson or something like that, different types of behavioral assessments to measure if a student has a behavioral disability or a learning disability, so that they can get the appropriate services. They will often work on the IEPs or the 504s. They'll consult with the teachers and families as to what can best help a student. They're also trained to provide culturally responsive services, as all of these professionals are. the nice thing is that they can really get that, the struggling learners, they're there to really give the support that's necessary for students. So if somebody is, they can identify where the student is struggling specifically and say, here's what we know as best practices or evidence-based practices that will help this student specifically in this area. You do need a minimum of a master's degree in school psychology. A lot of programs will take that further to get an educational specialist degree. So it is another, all of these roles also require extra education beyond, basic education, but it is good to know who's in the schools. And now we'll turn it over to Robin to give the one that she likes.
So my shameless plug is, if you would like to be a clinical counselor, you should also contact one of us to come to our program. So this is a recent development in having an actual clinical counselor based at a school. So this person might be an employee of school, but more likely it is somebody that is employed by an outside company that's contracted with the school. Many of our interns, especially at Unison and Toledo, end up at a TPS elementary school for a little bit of time doing some school-based therapist. So the wonderful thing about Medicaid is that they prioritize the treatment of children. Children could have therapy any number of times a week, and Medicaid is going to reimburse for it, which is very different from adults who are seeking treatment. But Medicaid very much prioritizes that if kids need help, give them the help, they will pay for it. Part of the problem is, and Medicaid also pays for transportation to appointments. Part of the problem is that the Medicaid cabs aren't very specific, and they aren't very good at minimizing the amount of time that you have to sit around and wait. They also will only pick you up at your house, drop you off at your therapy appointment, and take you from therapy back to your house. So kids who were going to see their therapist at a community mental health agency were having to, if they had a 10 o'clock appointment, they would go to school maybe from 7:30 until 8:30, but then they'd have to be home by 9 in order to make sure that they hit that 1 hour window that the Medicaid cab might have. But the cab can come anytime between 9 and like 9:45. And then they get you to your appointment, you go to your appointment, and then you could wait an hour for the cab to come back and pick you up. So by now the kid has missed almost 4 hours of school, and this wasn't nearly as productive as it could have been. So now the therapists actually have an office, hopefully in the school building, where they can provide services there. So this is going to be more of your long-term intensive individual therapy for individuals who have a trauma diagnosis or an anxiety diagnosis or a depression diagnosis. They may also do a little bit of group counseling, but that gets a little bit harder to arrange around a school schedule. And then they're going to collaborate with their school counselor, their school psychologist, and their school social worker for the best interest of the individual that they're working with. Now, the important thing to know is that with a school-based therapist that's employed by an outside agency, the child must also be a patient enrolled in the outside agency. They can't just see any kid that shows up in their office. They have to have done an intake with, so Unison, where they go to TPS, they have to have done a Unison intake. Most of our mental health agencies only accept Medicaid or are on the, or have a small grant. So many people who have private health insurance can't access necessarily a school-based therapist unless they're an employee of the school. It's a lot of fun. I've seen recordings because in internship, we watch recordings of our individuals and they do a lot of good work. So if you want to work with kids, but aren't certain that you want to be a school counselor, this might be the role for you. So, yeah.
And like Robin said, it's nice that they give that extra long-term therapy. That's something that school counselors can't really do, because as a school counselor, you may have ideally 250 students you're responsible for, and cannot provide that long-term 1 hour a week to a student because you have 249 other students that you have or more. And so to have somebody who is really focused on that one student who needs that extra support is such a wonderful thing to have, and it is really beneficial to the kids. And the nice thing is there's a lot of, like we said, the collaboration back and forth is very nice, because as the school-based therapist may be working on something specifically, can let the school counselor know, here's the things we're working on, and then in between the sessions, between the session with the student meeting with their license, their school therapist, and the school counselor can reinforce those ideas and reinforce those topics, which is a nice thing to do, because now the kid is hearing it from all sides.
Yep. Good deal.
Yeah. So the last one that we'll talk about today, we thought was important to add, because the speech and language pathologist, while their main role is to prevent, assess, and diagnose the speech and language disorders, social communication disorders, cognitive communication disorders, and I always find this interesting, the swallowing disorders. One thing that comes with that is, a lot of times when there's a communication disorder or some sort of speech disorder, there may be some social issues that go along with that, and some mental health issues that go along with that. So the speech and language pathologist will also, by addressing these needs, will also address some of the social needs and some of the social aspect that students with these disorders are going through. So that's always a nice extra addition to what our SLPs are doing. I know we worked very closely with the SLP at our school on different students, and they would work them into their groups and do a lot of different social training, and along with the speech and language training that they do. They also provide training and education to the families and the staff members on speech and language disorders, to try to let families know and to let teachers know what is the best way to support students with these disorders. And because, I mean, they're the ones who are trained in it and the experts in it. So, they have great ideas on how to best help students. A lot of times you'll find them on IEP or your MTSS teams, because a student with this disorder is also on an IEP. So it's important that the person who's the expert in that field sits in on the IEP, to provide, like we said, what are the best accommodations that student needs. They may support student transitions between schools, elementary to middle to high, and also beyond high school to what is your post-secondary life look like. So they'll help support student transitions. Again, it's a minimum of a master's degree to earn this. Now, a speech and language pathologist, they may have a number of different roles. They don't just work at schools. They could work in community centers or hospitals. But we're talking specifically about the SLPs in schools. Okay.
All right. So what are some of the reasons why you would contact these individuals? Well, ultimately, student concerns that are getting in the way of academics. So they're struggling with their classwork. There's a sudden change in behavior. So maybe someone who was sitting in your someone who's sitting in your class and does a really nice job and is really well organized, comes to class and suddenly their backpack is disorganized and they can't find their homework anymore. That kind of a thing, like a change in behavior, might be something that you want to direct them to the school counselor, because we know that teachers have a classroom of sometimes 30 individuals, and it's not always easy to address every student in the most individual way every minute of the day. So unprovoked outbursts, if their behavior changes, their outburst changes, if they're having problems making friends, particularly if they're new to the school district, that kind of a thing, are some of the basic student concerns that you might want to contact the school counselor. There are other things that if you find out, like let's say you find out parents are getting divorced, a family member has passed, a favorite animal has passed, that can be really disconcerting to students. So you might want to send them to the counselor of some sort, whether it's the psychologist, the social worker, the LPCC, or the school counselor, to help with that. So why should teachers go collaborate with any of these professionals? If you're feeling overwhelmed, many of these professionals is going to have a list of places where you can seek treatment if you need counseling. You need to manage something that's happening in your life. So the school counselor or the school-based LPC or social worker can't be your counselor, but they will have a resource list of who in the area will take your insurance and that kind of a thing. I know this because I've recently provided it to several of the school counselors who have been supervising my interns so that they can help out some of the faculty during COVID who have been stressed out and things like that. if the teacher is unsure of how to proceed with something that's going on in the classroom with one or more of their students, that might be a good time for them to come and do some collaboration with one of the mental health professionals in the school. And then if the teacher's frustrated, you're going to want, we all get frustrated. We're all human beings. Even the counselors are human beings. They may do a better job of hiding it, but they certainly do share with their counseling peers. But you get frustrated, and it's okay to express that and then move forward, because if you don't get that out, you're going to continue to be frustrated with the kid that's sitting in front of you. So it's okay to come and vent to these individuals about how frustrated you are. And they're probably not going to say to you, well, Tommy just told me that his parents are getting a divorce, or he caught his dad kissing Santa Claus or something, but they're going to give you some context enough that you need to know to move through that frustration. So remember, there's some confidentiality involved in seeing each of these individuals. JP, do you have anything that I missed?
No, I think that's it. I know a lot of times I would have teachers come in when they were frustrated with their students, and just getting some advice on, like, here's what this kiddo is. We may not tell you what they're going through, but we may have some ideas and say,
Yep.
They need a little bit of leeway right now, or and anything like that is just there to help out. And we serve the students, but we also serve the teachers and the parents when they have needs, and provide suggestions on where to go or where to get help, or sometimes just how to approach that kid that you're having a hard time connecting with.
Mm-hmm.
We may know some different secrets that about the kid that would be useful. So good.
Yeah. So I think we're going to move on to stress.
Mm-hmm.
There we go. Stress and its impact. So it's important that you are able to recognize when you are getting a little bit stressed out and how it can impact you kind of in general and a little bit specific. So we're going to talk a little bit about that, and then hopefully get to the point where we walk through how to create a self-care plan. We've recognized that sometimes we pack a lot into this presentation. So you do have all of the steps you need to make a self-care plan if we don't get to that as thoroughly as we would like. So, all right.
We've tried to speed it up as we get more or better at giving this presentation, but
yes.
We still, obviously these things are important to us, and so
Mm-hmm.
we like to go through them. So stress events happen all the time. It's just different events that happen throughout your life that cause your anxiety level to rise. The effects of different life events can vary based on the person. Some people are better able to handle these stress events than others. What may be very light to one person may seem like the end of the world to somebody else. And developmental level also plays into this. We often think, like, if you work in a middle school, I'm sure you know that some things that seem like the end of the world to middle school students, for most of us, are like, that's not a big deal. But for that student at that moment, it is the biggest deal in the world. And we have to be appreciative of that and understand that it's a very stressful moment for that kiddo.
Mm-hmm.
So the effects are given importance by the person who sees them. So it may not seem like an important thing to you, but for that person, it is an important thing that we have to make sure that we respect and understand that everybody deals with things a little different, and everybody responds to stress a little bit differently. Events that involve others are always more stressful than those that do not. So if it's, if there is something happening to somebody in your life, that's a much more stressful event than if it's just, you're going through it, you forget your lunch at home, that's a stressful event, but it's not as bad as if, you're getting made fun of by a peer, or somebody, your parents are going through a divorce, or somebody in your life is sick. Now we are all going through a major stress event right now, so I think it's important to recognize that everybody's stress level at this moment in time is a little bit higher, because we all are dealing with the pandemic in our own way, and so everybody's already at, typically we would have a lower baseline of where our stress level is, but because of this pandemic, everybody is a little bit higher than we typically are. So I think it's important to recognize that even in this time, the students that you're seeing are already at that higher level of stress, and they see that their parents are at the higher level of stress. And so they're already up here. So little things that may not be as big a deal in a normal time are much more impactful than typical. So other things individuals interact with and can shape or change, these stress events. So a lot of stress events, you have the ability to decide how you're going to respond to it. We can't control the event necessarily, but we can control our reactions. And that's the same thing to work with students, is that they have the opportunity to decide how they want to react. Now, the instant reaction, we may not be able to control necessarily. Now, people get better at learning how to control those instant reactions and how to instantly respond to things. But that long-term sitting down and thinking about, okay, how can I go about this? What's the best way to handle this? We have the ability to choose a lot of times. Some, not always, but a lot of times we can. And events that occur in families have a higher impact on stress when they are unique to one member and not shared. So if there is someone who is dealing with an illness, if there's somebody who has, we'll say, cancer, that's a higher impact on stress, because that one person is dealing with the cancer, even though everybody else is kind of worried about their family member. Robin, do you have anything to add to that?
No, not really. You did a lovely job.
Okay, well, thank you.
You're welcome. All right. So one thing that's important is that our environment is very impactful on our level of stress. So the environment that you're in can increase the amount of stress that you experience, especially if that environment is not a good fit. So I'm going to guess that we've all been in positions where we really liked the type of work we did, but we weren't so excited about the place where we did the work. And the environment just didn't fit quite the level that we needed it to in order for it to be something we were satisfied with. So when you have a good work environment, stress is less. People work together, they have a collegial relationship, and they enjoy the work that they do. But when you have a poor environment where people are mean to each other, or if you're in a place where everyone is kind of out to protect themselves and there's not a sense of we're all in this together type thing, you might be in an environment that's not a good fit for you as a person. Maybe you're not that competitive and you decide that that's not where you want to work. And you could be doing the same job in both environments and find that your stress level is so very different. So an example, I worked at a smaller agency. So when I worked in the DD world, I worked in a smaller agency where I was on call 24 hours a day for call-offs. So I could be sitting at home having dinner at 6 o'clock and find out that I was working a third shift. And that just didn't work for me once I got to the point where I was over about 60 hours a week of actually working third shift and then doing my 8 to 5 as management. So then I moved to the developmental center in Toledo, and I was still on call. I still had a pager, but I didn't have to handle staff call-offs. I just had to handle emergencies. And my job description was pretty much the exact same thing. It just got much easier because I no longer had to wake up and run into the agency at midnight and cover someone's shift. Now, I would run into the agency at midnight for emergencies, but those happen much less frequently than someone calling off for work. But that's kind of an example of how you can do the same job in two different environments and have the work be rewarding and fun, but not necessarily the place where you are doing it. So, JP, anything you'd add?
No, I think you did a great job on describing that.
Thank you.
It's very true that the same job at different places can have a big impact on your amount of stress.
All right. So stress is also can be very subjective versus objective. So stress that is more experienced, or environment that is more experienced by an individual person, is going to be more stressful. When you experience it in an objective manner where it's perceived by the group as stressful, it gets a little bit less impactful because everybody can kind of band together. We tend to find that individual people tend to perceive things as less stressful when others are around and helping them out, even if it's an environment that's stressful only to them. So in a good work relationship, when someone is experiencing a personal struggle and your colleagues band around you and help you out, you tend to find that experience a little less stressful than if your colleagues were like, whatever, they'll get through it. And everybody moves on with their daily life. So that's kind of the idea behind subjective and objective views of environment.
There we go. Okay. Wait, did I miss one?
No, I think
They're just out of order. Okay.
we're, sorry.
I think this is you still.
Oh, good deal. Okay. So the other thing is that the experiences can, when they happen, can have a impact on what happens afterwards, what the consequences of the environment and experiences are. So those are things that happen kind of in our formative days. So this could be anything from in utero to early teen age, so kind of formative, remote from when you kind of have the mental health consequences later, will increase the risk of development of mental illness, but it doesn't necessarily contribute directly. And the other thing is these formative events decrease our protective factors. So you could have a wonderful supportive family who suddenly experiences financial issues and then a tornado, and then they're really unlucky and they get a hurricane too. And each of those events that happened in childhood decreases that protective factor of the supportive family because they just don't even out quite as well. And those things contribute to the potential that someone can develop a mental health concern later in life. But then there are the precipitative factors that happen later in adolescence, in adulthood, that actually kind of contribute directly to the onset of mental illness. So for example, individuals that are diagnosed with schizophrenia tend to have their first psychotic break in late teens, early 20s. And the reason that is, and it is because they have all of these protective factors. They're living at home, someone's helping them make decisions, all of that kind of stuff. And then they get out on their own and they suddenly kind of lose some of those protective factors, and they outpace their ability to cope, and then they start to experience, or they're less able to explain away some of the psychotic symptoms, and then they have their first big break. So that would be their precipitative factors, those challenges that they get in early adulthood after they've left some of their protective places. So we need to be watching for stress events that happen both formatively and precipitatively in order to help prevent and treat mental health concerns. So, all right.
Okay, and so this leads to the idea of stress events, and these are the events over which you have no control, and are more stressful and predictive of disorders than those which you have had some control over. So these stress events can happen at any point in your life. They could be acute, like major, brief, temporary. There's a clear starting or stopping point. I think of somebody like losing a job would be a very acute stress event. It's very major. I mean, losing a job is kind of scary, and it's also it's brief, it's temporary, because lost that job, you all of a sudden you're like, I have no sense of source of income. I don't know what I'm going to do. But you can start moving forward, find a new job, get going with your life, unless it becomes somewhere where the chronic, which is the accumulation of minor life events and also major life events. We talk a lot in another presentation about adverse childhood experiences. And a lot of adverse childhood experiences are those chronic stress events, where if there is somebody in the home dealing with a substance use disorder, that's a pretty chronic event for a little kid to deal with that, and to watch their loved one constantly struggle with the addiction is pretty chronic. If people who live in poverty, that poverty can lead to a chronic life event, a chronic stress event, because it's constantly worried about like food, and constantly worried about safety, constantly worried about a shelter. Students who move a lot. That's why our students that are in the foster care system, they really always kind of tugged at my heartstrings, because they've dealt with these chronic life events their whole life, and so they have all this trauma throughout their life, really they have a lot of reactions to simple stressors. We talk about those simple stressors like the teacher saying, "Where's your homework?" For a lot of people who have a lot of protective factors, that's not that big of a deal. They may have that instant stress, like, "Oh my gosh, what can I do?" But for somebody who has dealt with these chronic stress events their whole life, "Where's your homework?" almost feels attacking, and the student might react in a very different manner. And as educators, we may look at that as like the student is being disruptive, the student is being is not paying attention, the student is just yelling at me and being subordinate or insubordinate. Whereas, the chronic stress events lead to that moment. So there's something going on there. There's other things that are going on. So again, that goes back to our earlier part of the presentation of working with the mental health providers in the school to kind of work with this kiddo to see what's going on. I feel like I got off topic a little bit there, but it is something to keep in mind, that those different things all have an impact on the students and us as individuals. Robin, anything else to add to that?
Nope, I think that's good.
Okay.
So, do you want to
go
do
ahead.
that? Okay. All right. So there are other things that can impact your environment as well. So pollution, starvation, loud, unpredictable noises, antisocial behavior, all sorts of things. The best example I have for this is when I was an adjunct here at BG. I was teaching in the summer on the 4th floor, and I swear to you, they were tearing apart the 3rd floor. There was a jackhammer that was always being used during my class. And just that loud noise was enough to disrupt the class from being productive. And we were trying to run group because we were in group class, and we just couldn't get focused on it. Because there was just way too much noise in the building. So you want to try to work to the best of your ability to decrease some of those environmental stressors. So if like there's a loud heater in the room, if there are people who are tapping on the desk, that might be something that kind of gets a little bit frustrating for everybody around the room, that kind of a thing. When I'm in class, I like to walk around, when I'm talking about this, I like to walk around the room and beat on students' desks and pound on them and ask them how they're learning now. And that doesn't really work very well. People don't learn through a lot of the environmental stuff that can go on. So make sure that you're trying to create an environment to the best of your ability that will decrease stress instead of increasing it. So.
That's a funny story, Robin. It makes me reflect back when I was a teacher. One of my years of teaching, they decided to build an elevator outside my room. So it was supposed to be done over the summer, but of course, they weren't able to finish it. And so while I was teaching, they're actually doing the same stuff that you were talking about, the pounding and the jackhammering and all the noise that comes with building an elevator was happening outside my room. And on top of it, the dust would blow into my room. So I ended up breathing in all this dust. Eventually I had to set a towel over the vent in the door just to prevent myself from breathing in all this extra dust. So that really was a stressful time for both me and the students I was trying to teach. I remember they're like, we can't listen to you because there's all this noise outside. And I'm like, well, at least it's the noise and not me. But
it's better. I mean, what's better is when we have the distraction from the firefighters on campus. That tends to distract. Oh yeah, when they mow the lawn. But when the firemen come to do their classwork in the summer, that's really distracting to some of our students as well, in a positive way. They're not upset by it. They enjoy watching it. So there's a couple different ways that you can have stress as a teacher. The students don't actually have to dislike the environmental stressors. So
right.
Yeah. Deal.
So the last thing is the impact of stress. Last thing that in our presentation, then we have we'll go through the self-care plan, because we talk about all these stressful things. Let's talk about ways to address it. But the impact of stress, it's just it can lead to a disorder from severe chronic strain, the chronic stress that comes from all these different events. So it can lead to disorders. It doesn't necessarily have to. It doesn't mean, oh, if I go through this, I'm going to end up with a mental health disorder, but it can lead to some high anxiety, some depressions, other major disorders. and childhood is a very high risk stage where the more stressful events, as these stressful events start to pile up, it can really lead to the subsequent development of a disease or disorder. Like I mentioned, adverse childhood experience disorder earlier. There's a lot of research that shows that can lead to a lot of health outcomes later in life, negative health outcomes later in life, such as mental disorders or other things. Um, and stress can influence the onset. So Robin was talking about those precipitative events as an adult, where a stressful event can lead to the onset of a mental health disorder or the recurrence of a mental health disorder. If somebody was struggling with depression and they're, they a stressful event happens, it could lead to another depressive episode. So it's important to be aware of that, and that's why we're going to talk about the healthcare plan and try to minimize the stress and find ways to handle the stress when it comes our way, because that's the other piece to this, is you can be preventative as well in what
So
you do.
the video is actually a TED Talk on how to perceive stress as a positive thing, and how to reframe the idea of stress as something that actually builds your ability to cope better. It's really interesting. She's very funny. But she's also 20 minutes long. So if you would like to take a look at her, she's pretty excellent TED Talk speaker. So awesome.
All right. So I will stop sharing this.
Yep. And while you're changing it out, so I want to ask a question. Why would you use a self-care plan? What is the purpose of a self-care plan? Does anybody know, like, what you would do with it? Either chat or unmute yourself and interject. Oh, we're very quiet. It's okay. Because a lot of people actually get this wrong. A self-care plan shouldn't be as only a reactive idea. You should not be just using your self-care plan only when you're reacting. You should be using your self-care plan and practicing their coping skills all the time, so that when you get to the point where you're starting to feel stress, you already know how to do it. I think it's funny when everybody's like, yes, I've got my self-care plan and this is what I'm going to do when I'm really stressed out. And I'm like, yeah, well, how about you practice that when you're not so stressed out that you no longer remember how to use that coping strategy, and you revert back to the ones that make you feel good but aren't exactly the best strategies in the world. So, all right, it looks like we've got our self-care plan up. And again, this is in the PDF that I stuck in the chat, so that you can take a look at it a little bit further. So does anybody have an idea of what their coping skills are? I can tell you that mine has to do with Oreos. I love Oreos. I struggle to go down the cookie aisle without picking up Oreos. I did a good job yesterday when I went grocery shopping. No Oreos came into the cart. But that is my self-care plan, to the point where I have moved my work from home area away from the kitchen, so that I do not just grab Oreos. And I've actually put some fruit on my desk in my new office area, because I could eat Oreos all the time. That would be one of my negative self-care coping skills. JP, do you have anything that you can think of that you use to cope?
I would say my positive ones are exercising. I tend to exercise a lot. And I also, for me, I like to be outside. So I try to combine the two, where I typically exercise outside, or I will go, for some reason, for me, yard work is very calming. So I'll go work in the yard. Now in the winter, obviously I can't do that quite as much. But even just shoveling the driveway is something that I find useful. As far as the negative ones, I would say stress eating is a big thing for me as well.
Mm-hmm.
I tend to eat when I get stressful. We have the chat is blowing up here.
I know.
I see it keep popping up. I haven't.
So we've got some. where listening to music, going for a walk. Yes, Maddie, taking a nap is a good form of self-care.
Mhm.
Yelling is a negative form of self-care, but I will admit I've done that occasionally as well. Playing with pets, not checking work emails on weekends. My students ask me that every time I tell them that I don't check email from 3 on Friday till 8 on Monday. They're like, how do you do that? I said, well, I take it off my phone so I don't have it available to me, type thing. Petting the cat or dog, outside and exercise, reading a good book. I love good books. I downloaded Dan Harris's 10% Happier. I'm going to try to read my first ever self-help book, so I'm hoping that'll go well. Shopping sprees can be negative or positive. I really enjoyed buying my desk for my office, but it was a little bit more money than I wanted to spend. And exercise. So those are lots of great ideas. So we've listed, I'm like, I want to scroll down, but I can't scroll down. So we've listed some positive and negative ones. So you need to identify then, what are your self-care needs? What are the areas that you are struggling the most? And there are 7, right? 7 areas that we have for daily self-care.
Yep.
Yeah.
Our 7 areas of wellness. And it's, I think it's important to think about each area of wellness when you are thinking about a self-care plan, because we could be really good in one area and maybe be struggling in another area, and overall that can create to some stressful events. So recognizing how do you address each of these is important. But I also think a lot of these can overlap. So I talked about exercising outside. For me, that's kind of my environmental and my physical wellness are both. I enjoy being outside. I enjoy being in the environment. And when you're exercising outside, I'm getting that fresh air. And so I'm getting the environmental piece to it, but I'm also getting the physical piece to it. So, that's probably why yard work for me is so relaxing, because I'm also improving, in my mind, I'm improving my environment by making the outside look nice, making the yard look nice, trimming bushes, planting flowers, things like that are all wonderful things for me. We just, this past summer, put in a flower bed. I'm up in my upstairs office right now in the winter, but we have a 3 seasons room that I do a lot of my work when it's not so cold outside. Right now it's too cold to sit out there, but right outside there is where we've just put this flower bed, and we'll get all sorts of creatures running by. We'll get birds, we'll get chipmunks, we'll get squirrels, and for me that just adds such a nice piece to what I'm doing, because I'm looking outside. It's got windows all around it. It's just a wonderful place for me to work. And I'm very productive there too. You'd think I'd be distracted, but I'm very productive there, partly because I'm in an environment that helps me be productive.
I think the 2 areas that people tend to overlook is intellectual and occupational as well. So intellectual wellness is just mentally stimulating yourself. So those people that read a book or are very artistic or creative, those types of things are things that we don't necessarily think of, but we might do to keep us well. And they're things we might let go of quickly when we're feeling stressed. So you may not make time to do the reading or any of those things. So that is also a possibility. And then occupational wellness, having fulfillment from your job or the academic pursuits that you have going on. And it can't just be, I make enough money. It's got to be, I enjoy what it is that I'm doing and I benefit from it. I get some personal fulfillment from it. But that also means not taking that so far that you give and give and give of yourself. I tell my budding counselors regularly that they have to, they're in this profession because they want to help, but they can't give everything of themselves. They have to maintain a work-life balance. So those are the 2 areas that I think we tend to forget about. We tend to remember to maintain our friendships, attend to our spiritual wellness, exercise if we like to, that kind of stuff. But we forget about the fact that we are also intellectual creatures who might want benefit from other aspects of self-care.
So emergency self-care happens when you face a crisis. Is when that we talked about, those events can come on without waiting for. I mean, they happen, and you aren't sure you can't plan for them. You can't say, well, this is what's going to happen. They just happen. So what do you do in those moments when that crisis happens? Is planning ahead of time will be useful, because then you'll have a sense of, okay, when this happened, now I know what I can do to kind of get myself there. Taking some deep breaths when that first occurs, finding ways to calm yourself, to center yourself is a useful thing. So what helps you relax? I know I talked about exercise being very important for me. One thing when I get a stressful event, I tend to just go for a run and not have a time or a distance or anything. Just go out and run or walk or something to kind of calm myself down, and then I come back and I'm ready to face whatever the problem is. Helpful self-talk is kind of convincing yourself, like saying to yourself, like, I can handle this, I can make it through this. These are the things I need to do. Finding that social support. Who are the people that you go to? Knowing who the people that you rely on when you have those issues are useful. I have, of course, my wife is one of my top social supports, but also I have a couple of great friends when there are stressful things in my life that I call right away. Unfortunately, with they're friends I've made along my life, and we no longer live close enough to each other where we can go over and see each other right away. But the nice thing is I can always call them, and they're always willing to talk when things are hard. And then figuring out what helps raise your mood, and what helps you when you have these tough times. So going through those things is an important piece. So think about that as you're writing your self-care. Is what are you going to do when that crisis comes? Because unfortunately we can't stop them, and maybe they're few and far between, but we're all going to deal with those stressful moments in our life. So how do you handle that when it comes up is important to think about. Dr. Dufresne, anything to add there?
No.
Okay.
We have 4 minutes, and I think 2
Oh
pages.
gosh.
All right. So what you're going to need to make sure that you do is reflect on some of your existing coping strategies and things, and decide what's working and what's not. And then examine the barriers you have to maintaining your self-care. So are you so busy with work that you need to figure out how to add in some of your own self-care type stuff? And then as you move along, you're going to work on replacing those negative coping strategies with the positive ones, and carving out a little bit more time and doing it proactively. That's probably the thing I would add to the self-care plan, is being proactive most. So what do we got left? So here is the form that you can fill out to create your self-care plan. So what are the things that you do daily already in each of those categories of wellness? What are some of the positive coping skills that you want to develop? And then what are you going to do in an emergency? And it's good to write down what you're going to do in an emergency, so that you can go back to it when you're reaching for the Oreos and say, oh, I was going to take a walk instead of reaching for the Oreos. That's my emergency self-care plan. So that's kind of the way that we would fill out this self-care plan. And it's an evolving document. It's going to change every time you encounter a new stressor. You're going to have to adapt things, and things will, your coping skills will stop working or need to be modified and made a little stronger. So
This is also a good thing for those of you that are working in schools to work with your students on too, to take some time and have them kind of work through these self-care plans and think about what to do when things are stressful for them.
Yeah. I think we came up with a bunch of ideas that you already came up with, which is awesome. Having a movie marathon could be replaced with binging Bridgerton on Netflix. That is appropriate as well. There are lots of things that on this list, though, done. I know, all 8 episodes in one night. There are a lot of things on this that can't be done right now. So you might have to take some of your activity strategies, like going to the local music store. It may not be open currently because of the pandemic. Going to the movies isn't necessarily something that you might feel safe doing right now. So you might have to find ways to do things that feel safe to you in the current environment as well. So any thoughts? Anybody have any questions in our last minute of the presentation?
Well, thank you all very much for the presentation, and for those of you who have joined us. I want to remind you, if you go back to the program for today. Sorry, I'm having trouble finding my words. If you go back to the program for today, we're asking that you go back to the main room at this point. And so if you go into today's schedule, you'll be able to click on that to go back to the main Zoom room. Thank you all very much for attending this morning, and we'll see you in another Zoom session here just in a couple of minutes.